Every time your heart beats, it pushes blood through your blood vessels with a certain force. This force is essential. It ensures that oxygen and nutrients reach every part of your body. But what happens if this pressure becomes too high or too low? Over time, it can quietly damage your organs without you even realizing it. This force is called blood pressure, and it plays a critical role in your overall health. So what exactly is blood pressure? Blood pressure is the force of blood pushing against the walls of your arteries as the heart pumps. It is measured using two numbers. The first number is systolic pressure, which represents the pressure when the heart contracts and pumps blood out. The second number is diastolic pressure, which represents the pressure when the heart relaxes between beats. For example, a reading of 120/80, written as 120/80 millimeter Hz, is considered a normal range for most adults. These numbers show how hard your heart is working and how resistant your blood vessels are to blood flow. Blood pressure is influenced by several factors: the strength of the heart's pumping action, the flexibility of blood vessels, the volume of blood, and even hormones and nervous system signals all play a role in maintaining proper pressure. When blood pressure becomes too high, it is called hypertension. This condition forces the heart to work harder and can damage blood vessels over time. It increases the risk of serious health problems such as heart disease, stroke, and kidney damage. On the other hand, when blood pressure is too low, known as hypotension, it can lead to symptoms like dizziness, fainting, and reduced blood flow to vital organs. One of the challenges with blood pressure is that high blood pressure often has no obvious symptoms, which is why it is sometimes called a silent condition. Many people may not know they have it until it causes serious complications. The understanding of blood pressure developed as scientists studied how the heart and blood vessels function together to maintain circulation. Maintaining healthy blood pressure depends on lifestyle choices. Factors such as diet, physical activity, stress levels, and sleep can all influence blood pressure. Reducing salt intake, exercising regularly, and managing stress can help keep it within a healthy range. Modern technology is also improving how blood pressure is monitored and managed. Artificial intelligence and machine learning are being used in wearable devices and healthcare systems to track blood pressure trends, detect abnormalities, and predict potential risks. These tools allow for early intervention and better management of cardiovascular health. Blood pressure is a key indicator of how well your heart and blood vessels are working. Understanding it helps you take control of your health and reduce the risk of serious diseases by making informed lifestyle choices and using modern tools for monitoring and prevention.